Hello, Insta fam. It's Dr. T here. How are you guys? Oh, don't you love it? Lipstick on the teeth. I just had to pop up and get a little bit of lippy on. Look good, feel better. If you guys know that charity, please donate. It's an amazing organisation. I'm just going to wait for you guys to jump on, but you know that you can come back and have a look at this at any time. And yeah, it's good to have you guys on at lunchtime. We're lunchtime here in Perth. Lovely to see you guys. So I know that everybody has been wanting to know what's going on with Dr. T. Where's she gone? She's missed her last 2 Tuesday night sessions. She promised us on the 14th of March that we were going to do a live and get a guest on, and that didn't happen. I know a lot of you are my patients and you're being informed that there's appointment changes and that I'm taking a little bit of time out. And I felt that it was my due diligence to you guys to just fill you in on what's going on with Dr. T. The first thing I want to do before I go there is just give a massive shout out to everybody who has rallied around me in this time. You know that whole saying, it takes a village to raise a child? Well, it takes a village to go through what I'm going through, and every single person, thank you very much for thinking of me. Every single person that has picked up the phone, sent me a DM, sent me a message and said, are you okay? Can I help in any way? You know who you are, friends, family, colleagues. I want to give a big shout out to all my wombies. You guys rock. I want to give a big shout out to everyone from Monash IVF and Pivot. You guys rock. Even the team from Perth Children's Hospital have been amazing. So I just want to say thank you, and I am feeling very loved in this moment, and that is not lost on me. But I am going to acknowledge the elephant in the room in that I am going through something pretty big. So without further ado, I'll tell you the backstory. As a busy mama, as a busy gynecologist, someone who preaches to all of my patients the importance of screening, I got my mammogram form last year, and due to COVID lockdowns and various things, it kind of just went by the wayside. And then earlier this year, I was doing the old, because, you know, it's something I would always tell you is know your own breast. Do your own self-breast examinations on a regular basis, every time for me in the shower, doing the check. Does anything feel different? And earlier this year, I'm like, does it not? Does it feel a bit different? Does it not? Not sure. And then I had a patient come into my rooms, they know who they are, for fertility preservation in the context of chemotherapy for breast cancer. And all the jigsaw puzzles fell into piece for me, and I'm like, Tamara, you know, you got to go get that mammogram done. So I did. I got the mammogram and the ultrasound because, of course, with dense breasts, you need the ultrasound done as well. And there was something pretty gnarly on there. Yeah, I could see it straight away. So we biopsied it, and then 3 days later, I have the diagnosis of breast cancer. So, of course, like everybody, I went into shock and denial and why me, and I've done all of those phases of grief, don't you worry. But oh shit. Well, even the F-bomb was dropped there a little bit. I just went into the mode that you go into is patient mode. And I started my first chemo yesterday. And I'm actually surprisingly feeling really good today. So it'll be, the journey from here on in will be chemo for 4 months, some surgery depending on some results that I am waiting on, and then possibly some radiation treatment. And I have the most unbelievable team surrounding me, and I'm so grateful for our medical system and all the allied health practitioners who have, thank you guys. This is a bit overwhelming actually. But I have an amazing team around me, and I have amazing colleagues around me who have stepped in and stepped up. And as with many things in my life, I know that there are lots of blessings to come from this. A lot of times in life when you've, fallen over and you picked yourself up and you brush yourself off and you've asked for the answer to why do I need to learn this lesson, it becomes clear. And so many of the lessons that I have had in resilience and solution-oriented thinking, don't you worry, I am leaning on every single one of those and all these beautiful messages of love that I have from you guys. So I guess the reason why I wanted to share this, not a lot of people would want to share their personal health information with their patients and their social media community, but the reason, my number one driver for this is to empower you guys with the knowledge that, you can prevent these things and you can detect them really early. And my cancer is very, very, very curable. According to my oncologist, we've got it early. And that is because I did do my screening test and I recognized the signs and I listened to the messages that were around me and I didn't put myself as a lower priority. And that's why we've got it. So if I can just educate and empower you guys to do your screening tests, please. None of us, I am possibly the healthiest person that I know. I do not smoke, I do not drink, I exercise every day, I maintain my weight, I eat good food, stress, I do my meditations and I spend time grounding, I spend time with my family. I am a fairly balanced healthcare practitioner, but cancer doesn't discriminate, right? It doesn't discriminate. So those screening tests, no matter how well you eat or look after yourself, those screening tests are so important. So, and I wrote them down because I was thinking I might have a bit of chemo fog today, but self-breast examinations, mammograms, ultrasound. If you don't know or you're unsure, lean into your healthcare practitioner, ask the question. There are some amazing free screening services available. Breast Screen WA is one of those. Cervical screening tests, none of us like having our pap smears, right? None of us, but they've got to be done, guys. These are very preventable cancers. Skin checks, we are of a generation where we have been exposed to sun damage. So just head along to that GP who specialises in skin. There's mole scan you can go to, or go to a dermatologist and get your skin checked. Cardiovascular, even us young folk, 50% of people who have their first knowledge that they're having a heart attack is sudden death, right? So get those cardiovascular risk factors, your cholesterol, you can do calcium screening in your 40s, metabolic screening, and get your bone mineral density checked. They're just a few that came to mind to me of essential women's health checks that we really should be doing, and don't think that you're invincible. These screening tests are in place for a reason. So anyway, I'm going to get back off my soapbox and come back to me, because I know there's a lot of people on here right now going, I'm one of your patients, Dr. T. What does this mean for me? What does this mean for me? Okay, so anyone who is currently under my care for fertility, reproductive medicine, for general gynecology, thank you for those good vibes. I'm channeling all the vibes, don't you worry. I did have there we go. Got some beautiful little crystals, keep those on. Train of thought. Current patients, right. We are going to keep you in my care as much as possible. I will be working to some extent. I'm going to ride out this first 21-day cycle of chemo and see how I go. I'm pretty good today, but I'm pretty souped up on steroids for the next couple of days, so I may crash and burn after that. I'm going to ask for your patience. I know it's testing, don't you worry. Remember, there's a blessing in that. I'm going to ask for your patience. Your appointments may be modified slightly. They may be moved a week forward, a week back, but I ask for your patience in that. For many of you, you will be set up with treatment plans for the next few months. and that will stay in place. And you know, we have a team of nurses, scientists, and other allied carers who will be there to support you through that treatment journey. To those patients who are already booked in to see me as a new patient, either at Womb or at Pivot, please be patient. Some of you I will definitely be able to see. Some of you I may ask my colleagues to look after for a short time. I will definitely be looking at all of your referrals to decide who I think is best suited to you. So don't worry, you will not be lost. To those people who perhaps are looking to submit a referral, or you already do have one but haven't got your appointment yet, don't panic. Again, I'm looking at all referrals. I'm making sure that if I can't see you in a timely manner, because I don't want you to wait, I will find a practitioner that I think is best suited to what you need. Now remember, you've all got choice. Every single person here has choice about who you would like to see. You are very, very welcome to wait for me. But I also know some of you, your patience has been stretched and I've come into your journey partway along. That's not lost on me. So stay in communication. We will, over the next couple of weeks, it's a little bit of a suck it and see. My work is my passion. It gives me purpose. So I do intending on working where I can. So just stay in communication. Let me know what you need. Don't bombard the reception too much. But certainly if there's something that's really distressing you and you need some certainty and clarity around that, let's just stay in communication. You guys know how much communication is important in this game. And I can promise you, yesterday was I've been a patient on the other side. Many of you know my IVF journey. I have that insight. But again, yesterday I was reminded of what it is like to be a patient. You know, the trust, the distrust, the uncertainty, the disempowerment, all of that, like it came flooding to me. So don't worry, I get it. So what's most important in that scenario is communicating how you're feeling and communicating what you want. And then to the best of ability, we'll try to meet that expectations. If not, we'll give you some choices. All right? So have no fear, you will not be lost. The big thing for me is, don't cry. I've cried 1,000 tears. In fact, you know what? Feel the feelings. That's what I've said to my daughters. Feel the feels. It's okay to cry. I've cried 1,000 tears. Tears of sadness, tears of anger, tears of regret, and also tears of gratitude. So feel the feeling, right? My intention and my promise to you is that I will not leave this space. I'm going to be here in, thanks Kylie, appreciate it. I will be here in 2 capacities. I feel that in a way this has happened to me to give me the opportunity to educate and empower you. So if you will be so humble as to accept coming along this journey with me, I will share my journey, my ups and downs, how I go through this breast cancer journey. I was told not to pink wash it. I don't know if you guys have heard of pink washing, but I hadn't until this moment. And I won't pink wash it, but I think I have a unique opportunity to educate you on breast health and breast care and breast cancer and everything else that goes with that. I'm going to tell you a secret. I tried the cold cap yesterday, but I'm going to go get my hair cut today. Going to go a bit radical. Haven't had short hair in over 30 years. So I'm going to see what that's like and you'll see me on the other side. But I'm fully prepped that I'm possibly going to lose it all. So now we're going to just decide, do I go that wig? Do I go the turban? Or do I just embrace the bald? I don't know quite what my head's going to look like bald. But anyway, so I'm going to lean into you guys for help with that, to help me along that journey. So I'm going to be here in that capacity. I really think that this is a mission that I'm put on this earth to do. The second thing is it's really important for me to continue the education piece in fertility and women's health. And so as much as I can, I'm going to continue with my Tuesday nights. I may lean into some of my colleagues to provide that support. Let's revisit some patient stories on a Tuesday night. But that's something I really want to do. And I am looking to do some fertility fact Fridays as well. I'm going to do some stuff for you on a Friday too. So I'm going to stay in this space because it's really important that you continue to get all the evidence-based information so that you can weigh up your choices and make plans and decisions on your own personal journey. Oh, thank you so much. Yes, I have reached out to our dietitian, Nick. I've reached out to an exercise physiologist. I fully intend to continue with my resistance and cardiovascular training. Apparently, it improves chemo uptake. But I'm going to take you on that journey as well and talk to you about some of the evidence around breast cancer management. And again, I'm just going to circle back to where I started, which is this gratitude piece, that I am so grateful for this community of beautiful men and women who have just supported me, have reached out to, I've had reach outs from colleagues that don't even work in my space to say, whatever we can do, you just let us know how we can help you. And it's amazing. It's amazing. It's amazing in these situations. And you know what? This is very parallel to the IVF journey. It's amazing how you'll get support in places that you don't expect, and sometimes you don't get support from places that you do expect, but you have to just go with it. No point getting angry because everyone has a life to live, right? No expectations. So I want to see the parallels in what I'm about to go through, and you can take some of those lessons across, I think. So on that note, oh my goodness, I'm going to have to go back and have a look at all of these comments, but I hope that that provides you some clarity. I hope that provides you with some food for thought. And if there's just one woman, whether it be you or man, or whether it be a family member, or whether it be a friend that you share this story with, if I can just help one person to either prevent or detect early breast cancer, then this live has been worth it. It really has. Look after yourselves. I, as I said, am not going anywhere. I'm a bit of an oversharer. So you will start to see some information about my journey here. We are there to support you at Womb. We are there to support you at Monash IVF and at Pivot. And we will help you in any way we can. It just might be in a slightly different way. And remember, open communication is everything. All right. So take care of you guys. I'm going to go and have a little lay down now before I head off to get my hair chopped. I am aiming for Tuesday night. However, I believe that the chemo side effects will really kick in probably Friday this week. So we're just going to wait and see. But we'll aim for Tuesday night, and if not, I will definitely be doing some education pieces for you later on in the week. Thank you so much. Yep, my husband is my rock. He's amazing, and my kids have been incredible. I'm going to share that story with you too, because that was possibly one of the most difficult days of my life. And if it hadn't been for the support of the Cancer Council, I think I would have floundered. But I will tell that story too in coming lives. Okay, my beautiful friends, thank you so much. We need to come up with a name for this tumour, by the way. I will send you through the picture. I don't know. The first word that came to me was Ralph, but I mean, Wreck-It Ralph just is all too funny. And then I just thought of Karen. It's such a Karen, right? But then I also have patients and friends who are Karen, so no offense. So if you've got any good names for my tumour, then let me know. All right, guys, have a beautiful rest of your week. Big hugs to all of you guys. Tell those special people around you how much you care for them. Live in the present, embrace every moment, and I will be here for you as you guys have been here for me. See you later.